Take one. Take two, actually. Hi, my name is Benjamin Linson, and I'm going to do the Cluster of Laslett. The Cluster of Laslett is for the primary SI nociception, meaning if there's any pain in the lower back region, we can rule in or rule out that the pain is coming from the SI joint. The first of the 5 tests we're going to do today is distraction. So I'm going to have my patient lie supine with her head on this side of the table. We're going to apply a vertical pressure on the SIAS of the patient, causing opening of the ilium to the sacrum on either side, causing also a stretch of the ligaments on the anterior side of the sacrum. You're just going to press down, and then, is there any pain?
No.
So there's no pain for that test. The next test we're going to do is the thigh thrust test. So I'm going to ask my patient to bring her knee to over here. Great, thank you. You're going to put your hand on the sacrum to fixate it to the bed. Sorry. Making sure not to put your hand also underneath the ilium if the patient can relax as well. This is for the right ilium. I'm going to apply vertical, a little bit of lateral pressure to the ilium through the femur, causing a thrusting motion between the ilium and the sacrum. You're also going to do that for the other side. I'm just going to do that really quickly. Putting your hand, one hand underneath the sacrum and not on the ilium. Okay. And then applying a vertical pressure with a little bit of lateral pressure. Asking the patient if there's any pain on either one of those. No? Great. So those 2 tests were negative. The next test we're going to do is the Gainsland's test. We're going to have the patient on the side of the bed with one of her legs, this side, is going to be the left leg coming off the table, and the other one brought to her chest, having the patient pull it towards her chest as well, and applying a little bit of pressure to both sides. Is there any pain? Great. This test is to find out if the shearing of the 2 iliums will cause pain. In this case, it was shearing of the right, posterior rotation of the right ilium and anterior rotation of the left ilium. You would do the same on the other side to test that shearing as well. And the final test, the final 2 tests we're going to do is the side lining. So if the patient can lie on the side. This test you can also do just on one side because it causes a compression of the anterior side of the sacrum and the distraction on the posterior side at the same time. So you're going to apply a vertical pressure on the crista iliaca on the anterior most part. Asking the patient if there's any pain. Also asking the patient if there's any pain in the Gainsland's test. And the final test we're going to do is the sacral compression test. We're going to have the patient lying prone on the bed, face down. Great. And we're going to feel for the sacrum. Great. Having a hand fully on the sacrum. As the ilium are both fixated to the bed, you're going to apply pressure to the sacrum vertically, asking for if there's any pain. No? Great. So with this cluster, if 3 out of the 5 cause pain, then you can rule in that the sacrum joint is highly probable of causing pain in the lower back region. If 0 of the 5, like this patient here, has no pain provocation from any of the tests, then you can rule out that the SI is